Hello and welcome to Healing Begins Here, brought to you by the Victim Service Center of Central Florida. I'm Olivia Oropeza, the VSC's Prevention Education Manager, and I'm so glad you're joining us today. Before we begin, please be advised that today's episode includes conversations about domestic violence, strangulation, and homicide risk. These topics may be difficult for some viewers. If you need support at any point, the Victim Service Center is here for you. We provide free, confidential services to anyone impacted by violence, regardless of age, gender, or background. You can reach us anytime through our 24/7 helpline at 407-500-HEAL or 407-500-4325. Today's episode focuses on one of the most lethal and misunderstood forms of abuse, non-fatal strangulation. Research shows that a survivor who has been strangled by an intimate partner is over 750 times more likely to later be killed by that partner. What makes this form of violence particularly dangerous is that it often leaves little to no visible injury. Joining me to break down the medical realities behind strangulation is Corinne Phillips, a SANE nurse specially trained in forensic exams and strangulation response.
Thank you for having me.
To start, can you explain to the audience the difference between choking and strangulation? Because we know sometimes that they get used interchangeably.
Oh, absolutely. Oftentimes people say I was choked, which medically that actually means that there was obstruction on the inside. There's something occluding your windpipe, causing it that you're not able to breathe. But strangulation is actually pressure or external pressure to the neck that could be applied by arms, by hands, by a ligature, by a leg. It's often a misconception that only hands can do strangulation, but actually can be caused by many things, many objects.
And I understand there are some misconceptions about how much pressure and how much time it really takes to cause damage. Can you clarify for our audience what that reality looks like?
Yeah, the community actually is really not aware at all of the dangers of strangulation and how quickly that someone can be rendered unconscious. So it actually takes less pressure to apply to the carotid arteries and restrict blood flow than it does to open a soda can, which if you think about it is not much pressure at all.
Yeah.
And you can become unconscious in 10 seconds or less, and even clinical death in 1 to 3 minutes. So we need to take this really seriously.
And many people may be unaware because they can't see those injuries when they occur. Maybe they don't feel them. What is happening in the body in terms of oxygen and different systems being disrupted when that strangulation occurs?
So when there's pressure applied to the neck, there's blockage of the blood flow to the brain. And if there's no blood flow to the brain, then those brain cells can't get proper oxygenation. Then those brain cells die. And with brain cell death, you have a traumatic brain injury. And this can lead to long-lasting effects such as memory loss, confusion, cognitive issues, mental health issues, and if enough pressure is applied long enough, then that can result in death.
Many people and even providers may be unaware of this information and may not be adequately screening patients or asking folks if this is something they've experienced. What can we tell providers about the necessity for screening, and what do we think they may be missing in these cases?
So over half of these victims of strangulation don't have any external injury at all, and that's why it's so important for us to screen for this. It's important for us to ask because someone who's been strangled may not even remember because after a traumatic event, there's a lot going on, a lot of memory loss, and being rendered unconscious can cause you not to remember the events that happened prior. So it's so important we ask, we screen, and then also for safety purposes as well, and for mental health issues. You know, you're at risk for suicidal ideations, depression, anxiety. So it's important that we ask these questions.
Are there any delayed symptoms or signs someone could be aware of that maybe they did experience some strangulation, or some signs that maybe some damage has occurred and they should get checked out?
Oh, absolutely, because again, like you may not have an injury on the outside and may think that this wasn't that serious, but you could have things like feeling confused, dizzy, feeling tired, headaches, nausea, voice changes, vision changes, and these are not limited. I mean, there's a long list of symptoms, so if you feel abnormal, something feels off, you should definitely seek medical attention.
So really emphasizing, even if you don't see it, maybe you don't even feel it, you know, if this occurred, it's really important to go get checked out and take it seriously.
Yeah, absolutely, because like I said, even though there's no external injury, every person who's been strangled is at risk for internal injury.
Additionally, we know that if someone's experienced strangulation, they're also at increased risk for other forms of violence at the hands of that same individual. Can you talk more about the increased risk once you experience strangulation one time by somebody? What does the trajectory of that relationship look like?
Oh, absolutely. So research shows actually that a man who strangles a woman, that woman is 750% more likely to be killed by that same man.
Wow.
So the statistics are pretty high, and that person is also more likely to be involved in law enforcement shootings, mass shootings. So it is important for us as a community to realize how dangerous this is, not just for the person who's involved, but for the community as a whole. It is the ultimate form of power and control, like they have the power over your last breath.
Can you talk a little bit more about that? Because a lot of times we know legally we must report for gunshot wounds or for life-threatening injuries, but sometimes strangulation isn't considered a life-threatening injury. So can you talk or advocate a little bit more for understanding in that realm?
Of course. So strangulation is now a felony in all 50 states. So this is really important to be able to screen for, to get early prevention, early intervention, because it is serious. And although it is not mandated reported as of this time, it is truly a life-threatening event.
And what is the importance of a forensic nurse or for a sane nurse who may be working with a survivor to directly ask about this strangulation, but then how can they advocate for that patient if they have experienced strangulation?
So when we take care of these patients who said they've been strangled or choked or smothered, we use all those terms because as we spoke earlier, people use all terminology. It's important for us to document injuries that we see, photographs, how the person felt, how they presented, behavior, all those things, because later on we can testify to that in court. We're able to say how the patient presented and what they said.
If you could tell the world one thing about non-fatal strangulation, what would that be?
It would be that all forms of strangulation are life-threatening. There is no form that is okay. That includes the choking game that kids are getting into these days. For sexual pleasure, that's not okay. Even in things like martial arts, it is important to realize that strangulation is dangerous and all strangulation is life-threatening.
Thank you. Thank you for being here today and for sharing that information on non-fatal strangulation and for the work that you do with survivors.
Thank you.
What we've heard today is clear. Strangulation is not minor, and it's never just a fleeting act of violence. It's a medical emergency and one of the strongest predictors of future lethal harm. But what happens when law enforcement responds? How are these cases investigated and charged? Stay tuned to find out. Hi, and welcome back to Healing Begins Here. In our first segment, we explored the medical dangers of strangulation. Now we're turning to what happens when law enforcement responds to a call involving this type of assault. Joining me now are Kevin Holmwood and Rebecca Bloomstein from the Seminole County Sheriff's Office to talk about how these cases are handled. Thank you guys so much for both being here today and spending some time with us to educate us on this topic.
Thank you for having us.
Absolutely.
Of course. So to start us off, can you guys talk to us a little bit about what happens when deputies arrive on scene for this type of case, maybe domestic violence involving possible strangulation?
Right. Well, we teach our deputies to look beyond what might be immediately apparent. As we know, sometimes these strangulation incidents, they don't have immediate visible injuries, especially on the scope of time that deputies might be responding. They might be responding within minutes of this happening, and it sometimes takes a lot longer for bruises or marks to appear. So we teach them to look beyond that, to look for what clues maybe the scene itself might be telling them. They look for, what is the neighbor, if there's neighbors, especially in apartment complexes, what might neighbors say, pulling 911 calls. The point is it's a comprehensive sort of investigation that takes place. They're not just going and saying, oh, well, there was no mark, so it didn't happen kind of deal. They're definitely taking the whole picture into account.
And that's very important in an instance with strangulation where we know those signs and symptoms may not show up till later, and many survivors may not be very upfront with expressing that. How do officers or deputies ensure that when you go and speak with this individual that you ask them directly or that you get that information from them? What does that typically look like?
Yeah. So as an agency, we've really embraced the philosophy that comes along with trauma-based or trauma-informed interviewing and trauma-informed investigations. So we teach our deputies that to come at these situations with the necessary amount of just simple empathy and grace towards fellow humans, right? That these people have just gone through probably something that's might be the most traumatic thing they've ever gone through. Mm-hmm. They also might have never dealt with law enforcement in any meaningful capacity beyond, maybe they got a traffic ticket for a stop sign, right? And this is a way more serious situation. So we teach them to have the empathy towards people, understand that people's reactions might not always look like what you think somebody's reaction would look like, but that doesn't mean that things didn't happen. It just means that everybody processes things in a different way.
It's very assuring to know that that training is taking place and that there's a lot of change happening to improve response.
Yes.
Can you guys talk to me a little bit about Florida law and how that looks at strangulation and maybe why it's a felony?
So it is a felony. It's actually with our felony battery in the same statute. Essentially for battery by strangulation, domestic violence related, it's got to have that domestic relationship or dating relationship. It's not just, it's impeding that normal blood flow, the normal breathing that someone would have. With the risk of great bodily injury or actually cause great bodily injury, as well as with that applying of pressure to the throat or neck. But it also goes and covers whether or not the mouth or nose get blocked. So it can be something more than just someone putting their hands around your neck. It could be a pillow or whatever the case may be, something else causing that obstruction of that normal breathing or blood flow.
Got you. So the statute includes maybe other cases like suffocation or smothering, including strangulation.
Absolutely.
You talked a little bit about some of the effects of strangulation. What are why is this considered so lethal? What are some of the lethality assessments you guys do to understand this?
So we have the lethality assessment that got put in place under the Gabby-Petito Act in 2024. We already had many of those questions already implemented in our domestic violence investigations. So we take that information because we do take that holistic approach. We want to know what happened prior to this incident, because a lot of times there's those incidences that might have seemed minor, or he just got angry and it's okay, and then it gets to this point and we might not know about those past instances. So we ask about the prior history. We want to know what's going on. It also helps when we're asking those questions for what services we can provide after the fact. With our community partners and things like that. And sometimes me being law enforcement, and like Kevin had mentioned, not necessarily having that interaction with them prior and coming into the situation saying, hey, based on this assessment, you're in a potentially lethal situation. And that kind of disrupts what they might think is a normal relationship, because they might not know any different, because that's just the relationship that they've been in and what they thought was their safe place. So once they hear that, they're like, oh.
Okay.
So it helps us and helps them work together to try and find the best safety plan that we can for them.
Yeah, that word is kind of a wake-up call for some folks who maybe they've only ever experienced that type of relationship or interactions. What challenges do you guys face when investigating these types of crimes and working with maybe survivors and perpetrators?
Yeah, and I think that the challenges we face with the DV strangulations are kind of challenges we face across the board with all DV crimes to a degree. It's that at the end of the day, there's always, by the nature of the crime, there's probably a significant connection between the survivor and the abuser. They may share children together. They may share pets, property. There's so many other life connections, and so it can make it challenging to, especially for those in a longer term abuse situation, to not only get the help they need, but to be able to break free of that cycle and to get out of that situation. So one of the things that our sheriff really emphasizes is partnerships with the community. So on our end as a unit, we partner extremely closely with our community partners, also with the state attorney's office, to make sure that A, when a case comes through, it doesn't just disappear into the void, that it actually gets actioned, but B, that we, outside of even the criminal justice response, that we can try and act as a liaison to help the survivors get the resources they need. A lot of times the resources are out there, they just don't know where to look.
Yeah.
And if we are the only people they're coming into contact with, then we're going to make sure we do what we can to direct them where they need to go.
Amazing. That sounds very reassuring to see that type of response, and just know that you guys are working closely with community partners. What would you guys say to someone who has experienced this or is in domestic violence situation or abusive relationship who is struggling to come forward because there aren't those bruises, there aren't those physical signs. So what would you guys offer as encouragement for those folks?
I would say that it doesn't matter whether there's bruises, whether there's marks or not, has no bearing on whether you should report it or not. And I would encourage that even people who, a lot of people aren't comfortable talking to law enforcement, and
right.
I get that. And if you're not, there are still other avenues you can report it to. You can still speak to a medical professional about it. You can still contact organizations like the Victim Service Center. You can still reach out even if you don't want to necessarily involve law enforcement right away. And maybe by reaching out to somebody else first and getting that level of comfort, you then they might feel okay to involve us down the line, and that's okay. At the end of the day, our main goal is for people to be free of these abusive situations, and however we can help that happen, let's make it happen.
Wow, that's a great way to reassure, I think, folks at home who might be watching this and who maybe not even now experience this, but at some point in the future they may. Thank you guys so much for being here today and for sharing your experience and for the work that you do.
We'll appreciate it. Thank you for having us.
Of course. What Kevin and Rebecca have made clear is that strangulation is taken seriously in the criminal justice system because of the risk it represents. But accountability is only one piece of the response. Strangulation is also a medical emergency and one that can be missed if providers aren't trained to recognize it. When we return, we'll hear from Dr. Jill Mason about why this issue matters across healthcare disciplines and why medical education is critical. Stay with us. Strangulation is not only a crime and a forensic issue, it's a complex medical emergency that affects the airway, the brain, and can cause long-term neurological issues. Joining me now is Dr. Jill Mason to help us understand why education about non-fatal strangulation is critical across medical disciplines. Jill, thank you so much for being here today.
Thank you for having me.
Of course. To start us off, could you talk to me a little bit about what an anesthesiologist nurse does, and why learning about this topic is so important?
Okay, so let's talk about what is a CRNA, a Certified Registered Nurse Anesthetist, another name for it, nurse anesthesiologist. That is a person who has a nursing license, has practiced in intensive care with critical care patients, high acuity levels. They then went on to get a doctorate of nurse anesthesia practice degree, and they learn anesthesia. In anesthesia, all we focus on is airway, breathing, and circulation, which is a direct link to non-fatal strangulation.
So during preoperative evaluation, before people are going into surgery, how important is it for these providers then to get a good trauma history and to be asking about non-fatal strangulation?
So the actual pre-op visit itself is definitely critical because we don't see what happens in a strangulation because it's an internal injury. So, but I also don't know by looking at you what medications you take, what's happened to you, what surgeries you've had. So the history is so important. And now add on a traumatic event where you could have had trauma to your neck or your carotid arteries or your vocal cords, larynx, trachea. I need to know about it because that possesses a life-threatening complication in the operating room with me for your airway.
So if somebody is going in to have surgery and they're going to be under anesthesia, it's vitally important that if they've experienced this or other forms of trauma that they make it known.
Absolutely. Here's where you need to treat your anesthesia provider, whether it's a nurse anesthetist or physician anesthesiologist, like a priest. You need to tell me everything, and it's confession time. And the more I know, the better I can take care of you, because everything that I'm listening to you telling me is prompting me with my training to ask different questions. And I'm actually evolving and changing my anesthesia management plan to what you're saying, to what I think can happen, what I'm going to try to anticipate, because anesthesia is the last place that we want to have an unknown airway complication due to a non-fatal strangulation event, and that ends in a poor patient outcome if they even make it off the table.
Right, so it's super important to speak up if you know you've experienced this and to get that detailed medical history before going into operation. What are some of the issues that could arise, or what are you looking out for in an area where maybe someone had experienced that and didn't make it known?
So what I'm looking for in the airway, and what we know is that very little pressure on the outside of the throat can do internal damage. It causes swelling, it could cause vocal cord dysfunction, maybe they're hoarse, maybe they feel like they can't swallow as well. All those things are key really words that are triggers for me to start asking more questions about this. Well, what caused that? How long has that been happening? We also take a look at oxygenation. Anytime, someone has pressure on their throat, which air is going through the throat, then what is not receiving that air on the other side could potentially have a hypoxic event of some kind, with poor oxygenation. We're also looking at the vasculature. And what do we mean by vasculature? Your arteries and your veins in your body. And those are really like little pasta noodles, and they do not like to be, handled forcefully.
Yeah.
So a small push on the outside could cause a micro tear, right? And then if now I'm going to put a blade in your mouth and put a breathing tube in there, was that the final straw that triggers the artery to completely dissect? I mean, just an analogy, how many people are walking around with a tear in their meniscus on their knee, and then they step off a curb, boop, that's it. Right now they've torn the whole thing.
Yeah.
So that's what we're thinking of, these really fragile carotid arteries in the neck and vertebral arteries. And when those have pressure, then we think stroke, we think blood clot, we think all kinds of hypoxic brain injuries.
So the reality is there can be damage that stays beneath, the surface for a long time after someone experiences that strangulation. From a medical standpoint, why is it dangerous for providers to only rely on visible injuries to the neck? I know we talked a little bit about those changes, but what can we do to increase providers' awareness of this and to move outside of just looking at the neck?
Well, a detailed history, with the pre-op assessment and telling me everything about your life, what you've put in your body, what's happened to your body is extremely helpful for me to figure out how am I going to get you safely through this anesthetic and this surgery, or if it was just a medical procedure that you needed to be put under. I don't know what's happened to you by looking at you from the outside, so you have to tell me. So we are going to communicate, and I'm going to ask you questions about everything, things that you don't think are important, I'm going to ask, and I'm hoping that you're going to be honest and you're going to tell me everything so that I can give you the best care. So, and like I said before, it's ever evolving. As I'm asking you the questions, I'm changing my anesthesia management plan for you. I'm customizing it for you. So if I had X-ray vision and I could wave over and see everything that happened to you, it would be a better world. But we don't. So we rely on other diagnostic tests, imaging, and so that history is critical to see if you need more of these things, before we're doing what we need to be doing, because I don't want a critical event if I don't have to have one.
Definitely. So Victim Service Center provides free trainings on this type of topic. Where do you see the value in some of that training for medical professionals?
I see a huge need for this for all healthcare professionals because, one, we don't want to re-traumatize you. We don't. That's not what a victim deserves. We want the best patient outcome for the surgeon, for the patient, for us. We are the surgeon and the anesthesia provider are the second victims if something terrible happens to you. So we are really pro 100% patient. And so we need to know, and we need to have more awareness, because awareness is going to save lives.
Well, Jill, thank you so much for being here today, for sharing on this topic, and for the work you do every day.
Thank you so much for having me. It's a pleasure.
As we've heard today, being strangled is not minor. It's not a normal part of conflict. It's a medical emergency. It's a felony crime. And it's one of the strongest warning signs of escalating violence and future homicide risk. If you or someone you know has experienced strangulation, seek medical care immediately, even if you feel fine. Delayed complications can be life-threatening. The Victim Service Center of Central Florida offers free confidential services for survivors, as well as free community and professional trainings on non-fatal strangulation, awareness, and response. If you've been impacted by violence or abuse, call our 24/7 helpline at 407-500-HEAL or 407-500-4325. You can also visit healhere.org to learn more. Thank you for joining us for this episode of Healing Begins Here, and remember, you are not alone.